everyone. My name is Mark Anthony with Edge on Regenerative Medicine, the show that changes people's lives. And we bring the best of the best doctors in their niches, in their categories, what they love. What's great about this doctor is he is from practices in North Carolina. You can also see Dr. John Stavrakos. You can go to John Stavrakos, osmd.com. So John, STAVRAKOSMD.com. Say that 5 times quick. See where I go with that. And the beautiful thing is we're going to be talking about a subject that I believe is not talked a lot about. It's going to be science-based medicine to helping people with a better life. The beautiful thing about Dr. John is he's not just one of those doctors where they just do one thing and that's it. He does quite a few things, but with a lot of perfection, with a lot of heart and study. And we're going to be talking a little bit about some of the things that he loves to do: stem cell, hormone replacement, PRP, neuroprolotherapy. And again, thank you so much, doctor, for being on the show.
Thank you. It's an honor to be here.
Awesome. So let's talk about this science-based medicine to helping people with a better life. What does that mean to you? But before we go into that, how did you get into this industry of just helping people that are in pain to, being healthy?
I think most stories, if you look at most people, physicians, kind of like any other job, I think your profession chooses you. So I wanted to be in medicine. I chose physical medicine and rehabilitation, PM&R, because it's physical medicine. Just like the name sounds, you rehabilitate people who have dealt with anything from stroke to head injury to the like. And I always lean towards the sports medicine aspect because I was athletic growing up. Gymnastics, 40 years of martial arts. And so like anybody else, I started getting injuries, and I was super healthy until about my mid-30s, and I was in my fellowship and my knee started bugging. I wasn't satisfied with the answers I was getting in the treatment plans. Therapy wasn't helping, and they said, well, let's get an MRI of your knee. I said, well, I don't think anything's wrong with my knee. I knew enough about medicine to say that, it's not a big mechanical issue. And it's about $1,000. When you're a poor resident, you really can't afford that. He said, well, we should see what's going on. Let's get a steroid shot. I'm like, I know steroids. So I started to realize that there was not a really, pain management was not that effective. And most pain doctors will tell you that. Our success rate is just not great. And I, by chance, got a copy of a book. My dad, who was a phenomenal physician, gave it to me, called Prolo Your Pain Away by Dr. Ross Hauser. And Ross is a guru in regenerative medicine. And I'm lucky to call him a friend now. And I happened to send a patient of his when I was working in Indiana, a patient of mine, to him. He was a big guy. He was an ENT who'd hurt his back, and the steroid shots weren't working. I said, "Are you willing to drive 90 miles to Chicago? This might help you." He had phenomenal results. So I took my first conference 8 or 9 years ago, and it was like a religious experience. I got my knees injected, and I realized I was just going down the wrong path. There's a much healthier way to do this with the evidence-based medicine that will get you healthy.
Wow. So your knees were bugging you.
Oh yeah. Yeah. My knees were bad, and my back would give me trouble. I'd been martial arts since the age of 9. I was a college gymnast. I was a varsity cheerleader, which I always joke, it's like powerlifting, stunting, and tumbling while you're smiling. And it takes its toll after a while. And it's amazing. My knees at 50 are better than they were at 40.
So let me ask you a question. When you were in pain, what would you say that your pain level was from 1 to 10 being high?
I've always had, a good pain tolerance for martial arts. I just can't tell you to suck it up. So I would deal with it. I would get down low and I would feel the discomfort. On the low end, it was kind of a chronic 3 to 4, kind of an ache. I'm not a pill taker, so I wouldn't take those. On a bad day, it was, I'd say a 7, where like.
What would you say you are now, though?
Now, my knees, 0 normally. On a really bad day, I don't warm up, maybe 3, and if I take care of them, the next day they're back to 0.
Wow. If I don't warm up, that's why people don't realize drink a lot of water.
You got to be smart about it. When you get older, you got to take some precautions.
Yeah. No, I'm an ex-tennis pro. I'm actually getting back into it.
Let me know about injuries. Sure.
I ordered my machine today, and I've been working with my kids, and now I'm like, you know what? I'm 43 years old, and my wife kind of looked at me. I go, yeah, but I got this competitive edge that just won't leave me. I think it's time for me to get back in.
Oh, sure. Sure. No one says you have to, surrender all the things of your youth. You got to modify them. But
My wife's like, what if you get hurt? I just go see a doctor and get a stem cell shot. I'm good to go, or some PRP.
Yeah, yeah. It's amazing. It's a wonderful. It's either a pack job, or it's almost like it's the best thing we've got to in a replacement. It's changed my life. It has changed my life for the positive in a lot of ways. I'm a lot happier as a result.
So you do have a book. I know that you are also an author, which is called The Athlete's Secret to Conquering Pain, correct?
Correct. Yes.
You can find that also on your website. So if someone would like to
you can. The email that you just gave will take right to that page, actually. Yes.
Okay, awesome. Well, they'll see it right here at the bottom, so that's fine. So tell us a little bit about, science-based medicine to helping people with a better life, if we can talk about that. What does that mean to you?
You got to look at the whole person. So it's a matter of when you talk to people come in usually for one thing or two things. And if you do your job right, you're gonna basically you give them what they want, because you tell them about how we're going to treat that. But then you got to give them what they need and say, what's the problem behind it? So if you've had a bad knee for a while and it's been bugging you, and you're an athlete, and like a lot of us, we got away from our schedule, we gained too much weight, we were too many times in too much time at a desk. You can talk about regenerative medicine. You do your workup. I say what might be working for you, but the knee's not the only problem. The knee's a symptom. Usually, it's the lack of flexibility. It's when your hip abductor muscles and your hip are bad, and your ankle's bad, and your core is bad. It affects other joints. I talk to them about their hormones and say, if you're in your 40s and you're wondering about the lack of energy and why you're not healing the way you used to, and this was personally happened to me once when I hurt myself. I was just wondering how long it took to heal as opposed to 10 years before. We want to optimize that. And the real step is to look at the whole person and say, it's not just about your knee. It's about your heart. It's about, guys, it's your prostate. Women, it's your breast. It's about not getting Alzheimer's dementia. It's not about stroke. And if you optimize hormones, you heal better. If you can fine tune the joints with the right kind of regenerative medicine, you can move, but it is up to you. I'm not the captain. I'm the executive officer. You're the captain, and I'll kind of guide you along. But change your diet commonsensically. Really, it's really simple. Exercise a little more, get out a little bit more. It's amazing the dividends that pays.
A lot of people don't realize that just the food that we eat, and a lot of people don't realize that they are allergic to certain foods that they've been eating for a long time. Like I get headaches religiously twice a month where I wasn't able to work. And I started to really pay attention to my body and realize it was a lot of the foods that I was eating that, like MSG. I'm allergic to MSG.
Sure.
And it really takes me down. And I had to change my entire diet. And if we would just focus on what we're eating and to realize that a lot of the sugars that we eat are not healthy foods, hurting us. Not all sugar is bad. No, we need some there. That's one of the chapters in my book, and I learned this from a really great doctor. The guy taught me IV therapy. Right.
That saying, the Hippocrates said, let food be thy medicine and medicine be thy food. I mean, it's really true. We've been fed a lot of misinformation about what's bad for you. It was all low fat. Growing up, I'm a child in the 80s. And of course, they turned the fat into what? Things would taste like heroin. They had to substitute the taste for something. They gave us sugars. Carbs, which turned to sugars like that. And now if you ask most cardiologists and, vascular surgeons, they'll look at people and say, you have a high sugar diet there, it destroys your arteries. You want to have a heart attack, have a high sugar diet, see what it does to you.
Exactly. So talk to us a little bit about stem cell.
Sure. So stem cells, as you know, I know, because you're an expert in the field as well. Stem cells are those, basically we call them the pluripotent cells, the ground zero cells that we all have, and people don't realize you still have them in your body. You don't have as many as when you were a child. When you're born, you got roughly one out of every 10,000 cells are a stem cell, maybe one out of every 400,000 when you're about 50. But those cells that basically differentiate in anything. And when people, kind of furrow their brows, they say, okay, you remember reading in high school biology, or when they would take a chick embryo or a mouse embryo, they would take a cell that's destined to be a brain cell. And it's early enough development, they can take that brain cell and they can put it in the thigh, and it will become a muscle cell. Why? Because every cell has the same DNA in it. It's just you stimulate, certain stimulants will turn certain genes on and genes off. So the advantage of stem cell, whether it comes from your own body, an outside source, is that it does have the potential, when you have damaged tissue, to do what is very, very hard to do in adults. It can possibly regrow tissues that the body's really stinks at regrowing, which is typically ligaments, tendons, and joint cartilage. Because all three tissues, when we're adults, don't have good blood supply. They're not nourished very well. And once you lose them, you tend to lose them.
Right.
And the results speak for themselves. If you've had it done, it's one of those things where I tell people, if you haven't had it done, it's hard to explain. If you had it done, no explanation is necessary, because you know how much better you feel.
Right. Have you used stem cells yourself?
On myself?
Yeah.
Oh, yes. Yes. On my, I've had them done on my right hip.
Okay.
And I won't bore you with the saga, but it's been a long, long, long uphill battle. And it's not an 18-year-old hip. I will say that the difference between where it was about a year and a half ago, to where it is now is absolutely night and day.
Wow.
Good road to recovery. And I've used them on people who I'll give anyone a chance if they're medically stable and they pass criteria, if it's safe. But I've had some people who have said, I do not want surgery. I can't have surgery. I know this may not work. I'm not the best candidate. Will you try it? And I will say, well, if you understand that, I will try. I've gone, what am I doing? I've had a couple people saying, I don't know if I'm going to give them false hope. And it's amazing how some of those ones where you go, oh, I've given this person false hope.
Right.
I feel so much better. I've lost 50 pounds. I'm walking better. And you look at their x-ray and you think, no way, it's never going to happen. And yet they feel better.
You know what? And I'm going to kind of shut out there real quick. People that, if you're thinking about getting stem cells, we have to understand that all stem cells are not created equal. Just like when you go to a pizza shop, not all pizza pies are created equal. I live in Vancouver, Washington. If I want to get a really good pizza, I want to go to Italy because I know they have really good pizza, or New York. But my point is that they're not all created equally. And I just wanted to let everybody know that. Now, tell us about, don't you have another practice and you're going to be opening up another practice somewhere else? I'm trying to remember.
Yeah, we're opening up actually our new clinic in south of Charlotte, North Carolina, in a town called Weddington. And we're going to be open in the next couple of weeks, actually, if all goes well. I can get
awesome.
Everything together. And so I'm really looking forward to that. So
I know that you've had people that, here's the great thing. If you're not in his area, there's a lot of people that actually fly out to go see this doctor. So, I just want to make a recommendation. If you're looking for like stem cells or even hormone replacement or PRP, or what would you say to somebody right now that is looking into stem cells but is possibly scared to take that plunge?
I would tell them, do your research. I'll give you the literature I know about. Do your research and, make a decision. Like many things, like a lot of things that are new in medicine and are, it's controversial. There's a lot of false information. There's a lot of half-truths about that. And frankly, there are some people who have bad practices, who do bad things. And unfortunately, like everything else, that tends to think the whole, one bad apple ruins the whole barrel.
We're seeing that right now online.
Oh, sure. I mean, you see everything like that. Same with hormone therapy. Good Lord. The first thing people say is, are those going to give you cancer? So, no, synthetic hormones will give you cancer, but natural hormones, really no evidence that I can find.
Let's talk about that. Let's talk about hormone therapy. How about how would you know that maybe you need hormone therapy?
You look at someone's overall, you look at their age, and you look at their complaints. And I ask a pretty thorough questionnaire. How do you sleep? And I'm talking like compared to when you were in your 20s, early 30s-ish.
Right.
Where you are now. Do you have issues with sleep issues, irritability? Is your hair thinning? Women going through menopause, perimenopausal, a lot of issues there. Guys, your libido. You have trouble keeping weight off. Now, we can all say these are all signs of natural aging. Well, sure, but why do we age? What's one big reason? One reason is our hormones decline. Guys, your hormones will start to drop as early as your mid-30s, women as early as your mid-20s. So if you're a 45-year-old woman and you haven't been any kind of replacement or whatnot, it's possible that some of those aches and pains and the lack of sleep and the lack of interest in sex and those things, you draw some hormones, you draw some labs, and you look and go, that sort of makes sense to me. But we can help you balance those out.
Wow, I love that. And so I know that you also do PRP, which is one of my favorite things to talk about. Let us know about what is PRP and how can that, what have you seen that help people in your clinic?
I probably do more PRP than anything. So PRP is like, I guess, the 2.0 version of regenerative medicine. Prolotherapy was number one. It started back in the 1930s, and PRP came around in the late 80s, early 90s. And there's probably not a sports team, professional or college otherwise, that does not have a PRP doctor. And, you know, if you want a list of athletes who've had it done, as I tell people, how much time do you have? Because we could go all day. It probably won the Pittsburgh Steelers a Super Bowl, I always say. Hines Ward got it, you know, before the Super Bowl in 2009, and he went from injured reserve to playing. PRP is a good example for people who don't worried about stem cell. Maybe they're not that bad, so to speak. You know, you fit the treatment to the patient. So PRP is simple. It's a blood draw. You draw your own blood. So the only thing that's not you is the anticoagulant, so it doesn't clot up. But it's all you. You spin it down in the centrifuge. You concentrate those platelets from, you know, to 7, 8, 9 times probably their normal concentration. And when people say platelet, that sounds familiar. I'm like, well, you remember biology? They made you look at a slide. There are these little tiny things on there. Platelets are what form a scab when you get cut. But we all know you can pick that scab in a week or two and you have perfectly smooth skin. What healed your skin? The platelets, you know? So it's amazing how when you inject them there, it's like adding fertilizer to a plant. Those growth factors, new blood vessels, wound closure, they bring in new collagen fibers to strengthen up the area. And how do you know? Well, your function gets better and your pain goes away.
I love it. What are some of the things that you've seen? Like, I'm gonna just throw this out there. Let's say I have really bad arthritis, or I'm starting to get arthritis. Not bad. I'm starting to get arthritis in my wrist. Do you think that would help out?
Yeah, because, you know, in most cases it can. X-rays help and MRIs help, but really your exam is what tells me. I always have to say this for people. There are always some people who are beyond what you can do. You know, there's some people who you realize that it's just so bad that I don't think the chances are good. Most people, however, fall into that category of you're probably not going to get better on your own. You need some kind of intervention, but I think it will help because a lot of arthritis comes from abnormal motion, and a lot of abnormal motion comes from damage to your ligaments, you know, in your wrist. You know, your wrist is 8 little bones like a ball, you know, right, stuck together, and there are ligaments holding them all together. When they start to get loose, things start to move abnormally. Things that move this way start to get axial movement and rotational movement, and you know, things rub on things that shouldn't. Cartilage starts to go away, and you form more arthritis. If you can stabilize a joint, you know, I would say PRP is kind of like having a solder gun or a jackhammer and putting screws in there. If you can stabilize a joint, it's amazing how the pain goes away.
Wow.
But in the right cases, if it's not too bad, there's even evidence it might be able to help regrow cartilage in damaged areas.
Okay. Wow. Okay. So would you say in some cases PRP is better than stem cell?
In some cases, it's more appropriate, I would say. I have people come into the clinic who are ready to write a check for stem cell, and I will look and say, I don't think you're at the point where you need stem cell. I say, look, it's you have a raccoon in your backyard. You know, it's biting your dogs. Do you need a 50 caliber bullet? No. PRP is more like a 44 Magnum. You know, a 44 or 9mm will do just fine. So
right.
It's there's a lot of people out there who come for stem cell, and I will look and say, I want to do. People say, what's the right treatment? It depends on the person. You know, you adjust it to the person's needs.
Okay, I love that. You're like, well, this is what I recommend. We can do this, but this is what I recommend.
If you want stem cell, I can do it. I'm fine with that. If you're a high-level athlete, you know, or someone who is going to put a lot of stress on a particular joint, and you do get those from real active people, we might go a little higher. Certain joints, like, for example, your hip, hips are tough. Hips are usually often, there's stem cell, and I found that out myself. I did PRP several times. But a lot of joints, PRP, when done right, in combination with a healthy diet, anti-inflammatory diet, eat well, sleep well, get your hormone balance, it's amazing how much PRP can do for you.
You know, that's actually huge. You hit on a real, I'd call it a really good topic, is that inflammatory. A lot of people don't realize that sometimes we'll take stem cells or things like that, but if we're still eating inflammatory foods or we're smoking and stuff like that, there's nothing that we can really do. I mean, not saying you can get better, but it's hard for the body to heal.
Right.
You know, I'm just saying, how about neuroprolotherapy? That's something that I do not hear a lot about. What is that?
That's interesting. And that's something that, it's sort of been done in other forms for years, but a couple years ago, I want to say 15, 20 years ago, a New Zealander by the name of John Liftoff came up with it. And he based it off of natural medicine. So neuroprolotherapy is the injection. It's looking at areas that hurt, and you're looking at the little cutaneous nerves on your skin. You know, if you lined up all the nerves in your body, and an average person would be about 44 miles long. Most of those nerves are not the big ones, like in your back. They're these little nerves, like there's one here and there's one here. And so Dr. Liftoff did a smart thing. He looked at this thing he calls it Hilton's Law. And John Hilton was a British surgeon and an anatomist back in the mid-19th century in England. And he was the most famous anatomist of his day. He used to dissect cadavers all day.
Right.
Anatomical John. If you had a question, you asked him. And what he found is that the nerve that provides sensation to the skin is also the nerve that provides innervation of the muscle and to the underlying, even the joint. So if the nerve is trapped or compressed or squeezed at the surface level, it's going to cause pain even deep. So if you take a very harmless solution like simple sugars like dextrose or mannitol, real harmless stuff, about a 5% solution, and you inject along those nerves, it's amazing a lot of times how your elbow pain or your shoulder pain or even your low back pain will just calm down.
Wow. Well,
that sounds weird, but I've had it done, and I didn't really believe it until I had it done to me, and then I became a believer.
So would you say that would help with somebody that maybe, let's just say they used to weightlift, bodybuild, and they're in their mid 60s and now not able to do what they were able to do as working weights because they're bone on bone, or how some doctors will say you're bone on bone, but you're really not, or they'll say we need to do something.
Right.
Because in a lot of cases, would something like this be with somebody that has been told they're bone on bone, possibly would that help?
It can, it's a heck of an, I tell this, at worst, it's a really good adjunct to other things like STEM or PRP. In a lot of cases, when you just get like an ache and maybe the x-ray doesn't look that bad or it doesn't explain what's going on. Because let's face it, we all get arthritis. Even if you have my shoulder feels fine, but I guarantee if you x-rayed me, my 50-year-old shoulder looks way different than it did at 30. Well, you know that. But really, arthritis is a given. But symptomatic arthritis, does it have anything to do with what's going on with you? Maybe yes, maybe no. So when I exercise a lot, I'll get pain right over top of my shoulder here, this biceps tendon. And it gets throbbing and aching, and people will say, well, do a steroid shot. I'm like, no, I don't want to weaken my tendon. And I'll just find there's a series of little nerves that come off your neck down to here. And if you literally just inject along there, I give it about anywhere between a couple minutes to an hour or so, and it just calms right down. So the nerves are upset, and the nerves calm down. They tell the joint below, hey, settle down, and you feel good.
Love it. No, so I love it. I always tell people that it's interesting how stem cells is still I call it in its infant stage.
Yeah.
We're still learning about new things, new technology, not technology, but new things that it's doing to helping people heal. There's also a lot of video games, believe it or not. My son plays video games, and I started playing with him just, keep that bonding going. And what was very interesting, I was dying, of course, in the game because I'm not that good because I'm always working.
Right.
I'm playing, and he's got his little helmet on, and he says to me through the ear set, he goes, "Dad, hit some button." And I'm like, all right. I go, okay. And I hit it, and I'm a military character, and all of a sudden he pulls out of his pocket a stem cell syringe. And he put it where the pain was. And the energy level went back to life. So it's interesting how I'm seeing this in video games, and
it's in popular culture now.
Yeah, they're getting cognate into people's brains, saying, hey, I don't know, for me, I believe in the future it's going to be where you can go to a Walmart or a Target, of course, 15, 20 years from now. And, they're just, maybe not, but it just seems that way since, the times that we live in. What would you say with neuroprolotherapy that you've seen how it's worked very well with certain types of patients? Like what type of patients have you seen that have come to you that you've seen totally 360 in their life?
One lady that I see a lot of, and she's a case in my book, and she's a patient of mine. She's doing great. Was a lady who had trigeminal neuralgia, which is, if you're not familiar with it, it's when the nerves in the side of your face, there's a nerve in your face called the trigeminal nerve. It's a cranial nerve, and it provides sensation to the top, your jaw, and here. And this division was causing her, they call it the suicide neuralgia because it's horrible pain. Hers was a case where she was very tender. If you touched her or she sneezed, it was crazy.
Wow.
And I said, look, I got the feeling that a lot of your problem, it was a guess. I said, look, I can't go in there and get that nerve because it's really, really deep. You need a surgeon for that. But a lot of inflammation here. She'd had some trauma to the area. I'm like, if these nerves are kinked or pinched, then they're sending signals. And so she came in, and at first she came in about a week, 2 weeks for a couple treatments, and then it was down to once every 4 weeks, and it was once every 2 months. Now this is gone. She's come since saw her once for a touch-up or twice because she said, I think it might sort of be starting. And she hasn't done it for a long, long time at this point. But I've seen it for, you and I chatted before about frozen shoulder. Yeah. Not all frozen shoulder is frozen shoulder. Sometimes it is just the nerves that are flared up. And if you can identify where you go and inject those nerves, and just ask somebody, okay, you got your arm here, 90 degrees last time, and they can get to 130 degrees or so. If you do a couple treatments, a lot of times it takes care of the problem.
Wow. I love that. I mean, medicine is unbelievable. I call it the right medicine, because not all medicines work for, the same for every person, because everyone's different inflammation, a whole bunch of things. So I know that you're going to be opening up in about 2 weeks. And that's going to be at johnstavrakosmd.com. Is that correct?
The clinic website will be up pretty soon. That's a different one.
Is that a different one? And can we maybe give a shout out to what the name of that will be so I can have it on?
Sure. It's Heritage Regen Med. So Heritage Regen, med.com, or if you want to, the best way probably, because it is up and about, and if people want to private message me or call in, my Facebook site. If you just go to Facebook and Heritage Regenerative Medicine, you should be able to find my site.
Again, everyone, we have it here in the bottom, there. So you'll be able to get a hold of him, instant message him if you have any questions. He would love to see you. And Dr. John, I just want to say thank you so much. It was an honor. We hit on a whole bunch of stuff really quick. I love it.
A lot, yeah. Well, I appreciate you cutting all that.
Well, it's great because normally we'll talk on one subject, but I love this talking on bits and pieces because there's people in our audience that are struggling with neuropathy. They're struggling with frozen shoulder. They're looking at stem cells injections, and they're looking at PRP, which PRP is unbelievable. Or they're looking at exosomes, which we did not get on, but Dr. John, he also does exosomes. And as a witness, I tried exosomes about 4 months ago. I have a major case of scoliosis. Mm-hmm. So, I'm always having to work on my posture, and I was starting to get the shooting up pain here. And long story short, and yes, I do get adjusted, at least, but I did the exosomes, and let me tell you something, I haven't had any pain for the past 4 or 5 months. So if you're looking at exosomes, people, he also does exosomes, Dr. John. Yeah. So again,
you can't. I tell people people say you can't argue with results. People, how do I know? People say, how do you know it's going to work? Tell them you'll know. I guarantee your body will tell you.
And video testimonials is huge. When you have somebody like myself that's had it, I'm like, hey guys, you guys want to do it? Because I'm someone that's been in pain. I had a slip disc, and the reason why I do what I do, and I'm always bringing doctors on, is because I believe in these doctors. They've helped me. I had a slip disc, and I was out of work for almost a year, and I was taking all these pills that were not making me feel better. And again, some pills don't. Some pills work for people. Not all pills are bad, but the certain type of pills that I was taking was not working. And then I got help from a doctor, and which was actually a chiropractor / neurologist. And then from there, I haven't had any problems with my disc. So, and then helping my family with fibromyalgia, helping my family with not just fibromyalgia, but my dad has diabetes, helping him get out. So guys, we have these doctors here because they help people. So make sure you guys call Dr. John and take a look at his book. You'll be able to see it on his website. We'll also have the link down at the bottom where you can also download it. It's an awesome ebook. And God bless you all. Remember, sharing is caring. Make sure, internet land, you share this. Why? Because one video, guys, one video can change one person's life. Even if you're not in pain. I'm sure there's one person on your page, Instagram, Twitter, Facebook, YouTube, someone has some pain. Let's help them out. God bless you all. And again, thank you so much, Dr. John.
Thank you so much. God bless.
You probably have an old school website, just like this old school Voltron from the 80s. Here's the thing. Video websites are dominating the entire internet right now. But only 3% of people have video websites. What is a video website? When there's continual movement. The beautiful thing about continual movement is that when you have movement, it keeps the buyer wanting to stay on the website. Here's the beautiful thing. If you look here at Dr. Mo's website, he is dominating. His website's everywhere. Not only that, but He's omnipresent. It's about time to get you out of the static world websites where they don't move, doesn't do anything for you, but come into the video websites where we dominate Google and get you omnipresent. It's time to step in the future of marketing. Make sure you click on the button at the bottom for a consultation, and we'll get back with you.